hypothyroidism also. You can get it in growth hormone deficiency. Okay. Some important causes of short trunk dwarfism. But before that, can you imagine what will happen to the upper segment is to lower segment ratio in short trunk dwarfism? So let us see. The upper segment is to lower segment ratio. So what is happening in short trunk dwarfism is the trunk is short. So the upper segment is decreasing or the numerator is decreasing. So the ratio will decrease. Okay. So upper segment is to lower segment ratio decreases in all the causes of short trunk dwarfism. While what happens in short limb dwarfism? So in short limb dwarfism, the limbs are mainly short. So the lower segment is decreasing. The denominator is decreasing. So the ratio will increase. So upper segment is to lower segment ratio increases in all the causes of short limb dwarfism. Right? And we can understand now why. Okay. Now moving on to some important causes of short trunk dwarfism. So let us see some important causes of short trunk dwarfism are. So there is something known as spondyloepiphyseal dysplasia. Okay. Spondyloepiphyseal dysplasia. So though the name sounds to be very complicated, but remember, if there is a spondylo in the name, that means the spine is most commonly affected. Okay. So because the spine or the vertebral column is most commonly affected here or more affected here, so the upper segment is mainly involved because the vertebrae are involved. So it is a cause of short trunk dwarfism. So causes of short trunk dwarfism are the conditions where predominantly the vertebral column is involved. We will get short trunk dwarfism. Okay. So they are spondyloepiphyseal dysplasia, spondylo meaning spine. Then there is a metabolic disorder called mucopolysaccharidosis. Okay. A similar condition as compared to mucopolysaccharidosis is mucolipidosis. That is also a lysosomal storage disorder where mainly you get bony changes in the spine. Okay. Then if the child has Cary's spine or TB spine or Pott's disease, okay, Cary's spine or Pott's disease or TB spine, then you can get short trunk dwarfism. Okay. Similarly, if the child has hemivertebra or butterfly vertebra, okay, hemivertebra or butterfly vertebra, so any congenital vertebral defect can give rise to short trunk dwarfism. This butterfly vertebra is seen in a condition called Ala-Gille syndrome. It may be asked in MCQs for you. So Ala-Gille syndrome. So in Ala-Gille syndrome, what all do we get? So we get butterfly vertebra, then we can get cholestasis, neonatal cholestasis. So it is one of the causes of conjugated jaundice in newborn or infancy. Okay. So you can get neonatal cholestasis or conjugated jaundice. There can be facial dysmorphism or triangular faces. The face is triangular in shape in Ala-Gille syndrome. Okay. Triangular faces can be there. And there are presence of some heart defects like pulmonary stenosis. Okay. This triangular facies is also seen in another disorder which has been asked in the MCQs previously. So this triangular facies is also seen in Russell-Silver syndrome, another syndrome where you can get triangular facies. Russell-Silver syndrome has been asked in the NEET pattern previously. Okay, so in which of the following syndromes you get a triangular facies? That is Russell-Silver syndrome, or in the presence of conjugated jaundice and vertebral defects, it is Alagille syndrome. So these are some important causes of short trunk dwarfism, which we can remember by a mnemonic. So let's see what the mnemonic for short trunk dwarfism is. So it is: short man may climb high. Short man may climb high. So you should never underestimate anyone, including yourself. So short man may climb high is the mnemonic here, and let us see how it works here. So with S, you have spondyloepiphyseal dysplasia. With M, mucopolysaccharidosis. Another M, mucolipidosis. Okay. With C, Carey's spine. With H, hemivertebra, or any congenital vertebral defect. So that is the mnemonic here. Short man may climb high. So these are some important causes of short trunk dwarfism.